Hello everyone. Today we are going to discuss one of the most important CNS infections asked in microbiology and pathology exams, meningitis. By the end of this video, you'll understand its causes, pathogenesis, clinical manifestations, CSF findings, lab diagnosis, and treatment. Before discussing meningitis, let's quickly revise the layers covering the brain. From outside to inside, we have the skull, the dura mater, arachnoid matter, subarachnoid space, and finally pia matter. The word meningitis can be broken into two parts. Meninges refers to the coverings of the brain. Itis means inflammation or swelling. So meningitis simply means inflammation and swelling of the brain coverings. But in a true sense, meningitis refers to infection involving the subarachnoid space, as you can see here. Importantly, the dura mater is usually not involved. Now that we know what meningitis is, let's classify it. Meningitis is broadly classified into two major types. First, pyogenic meningitis. Here, CSF shows increased polymorphonuclear cells or neutrophils. It is caused by bacteria, and among bacterial causes, Streptococcus pneumonia is the most common. In aseptic meningitis, there is a rise of lymphocytes, and the main causes include TB and enteroviruses. Now, let's understand how organisms reach the meninges. The most common route is hematogenous spread. The organisms travel through the bloodstream and enter through the choroid plexus or any other blood vessels of the brain. This is the most commonest mechanism in meningitis. Another route is direct spread from nearby infective structures. Examples include otitis media, mastocytitis, and sinusitis. The infection extends directly into the meninges from these adjacent sites. Organisms may also gain access to anatomical defects in the central nervous system. This can occur after surgery, following trauma, or due to congenital abnormalities such as meningocele. These defects create a pathway for organisms to enter. The least common route is direct intraneural spread along nerves. A classic example is rabies virus infection. The virus travels through nerves and reaches the central nervous system. Once infection develops, the patient shows the following symptoms, which include high grade fever, vomiting, headache, and photophobia, which means intolerance to bright light. The first sign is neck rigidity. In meningitis, the inflamed meninges become very sensitive. So, when the patient tries to flex the neck, stretching of this inflamed meninges causes pain and reflex muscle spasm, making the neck very stiff. The second sign is Kernig sign. To check this, the hip and knee are first flexed to 90 degrees. When the examiner attempts to extend the knee, the patient experiences pain and resistance. This happens because extending the knee stretches the inflamed meninges and nerve roots, producing pain. The third sign is Brudzinski sign. Here, the examiner passively flexes the patient's neck. The hips and knees automatically flex. This is actually a protective reflex that reduces tension on the inflamed meninges and helps minimize pain. Now, coming to lab diagnosis, first one is specimen collection. The most important specimen in here is CSF, which is collected through lumbar puncture. The other specimens are blood for culture and Mr. Urine. Biochemical analysis give us an idea about the type of meningitis. In pyogenic meningitis, CSF pressure is highly elevated. Leukocyte count is markedly increased with neutrophilic predominance. Glucose is decreased and protein is markedly elevated. In cryptococcal meningitis, pressure is normal or slightly elevated. Lymphocytes predominance, glucose remains normal, and protein is normal or slightly elevated. In viral meningitis, it is lymphocyte predominant, glucose remains normal, and protein is normal or slightly elevated. In tubercular meningitis, the pressure is moderately elevated and may show cobweb coagulum formation. Lymphocyte predominant, glucose is slightly decreased, and proteins are increased. This is the pro table which simplifies the previous table. In bacterial meningitis, there's increase in neutrophils, decrease in glucose, and increase in proteins. In viral meningitis, there's increase in lymphocytes, glucose is normal, and protein may be normal or increased. In TB meningitis, we have increase in lymphocytes, decrease in glucose, increase in proteins. And lastly, we have cryptococcal meningitis. In this, we have increase in lymphocytes, glucose is normal, protein may be normal or increased. But why do these changes occur? Neutrophils increase because they are the first responders against bacterial infections. Glucose decreases because bacteria rapidly consumes glucose. Protein increases because inflammation damages the blood-brain barrier, allowing plasma to leak into the CSF. Why in viral meningitis? In viral meningitis, lymphocytes predominate because viruses trigger cell-mediated immunity. Glucose remains normal because viruses do not consume CSF glucose significantly. Proteins remains normal or slightly elevated due to mild inflammation. Why in tubercular meningitis? In tubercular meningitis, lymphocytes predominant because tuberculosis is a chronic intracellular infection. Glucose decreases because the organism utilizes glucose. Proteins increases due to chronic inflammation and protein exudation. After biochemical analysis comes microscopy. For pyogenic meningitis, gram staining provides valuable clues. Streptococcus pneumoniae appears as lancet-shaped diploid. Streptococcus agalactiae appears as cocci arranged in short chains. Other organisms also have characteristic appearances. Neisseria meningitis appears as gram-negative intracellular diploid cocci. Haemophilus influenza appears as pleomorphic gram-negative bacilli. E. coli simply appears as gram-negative bacilli. So remember, Streptococcus pneumonia appears as gram-positive lancet-shaped diplococci. Streptococcus agalactiae appears as gram-positive cocci in short chains. Neisseria meningitis appears as gram-negative intracellular diplococci. Haemophilus influenza appears as pleomorphic gram-negative bacilli. E. coli simply appears as gram-negative bacilli. For tubercular meningitis, Sadan staining is performed. The presence of acid-fast bacilli supports the diagnosis of tuberculosis. For cryptococcal meningitis, in preparation demonstrates the capture of Cryptococcus. For parasitic meningitis, wet mount examination can detect trophozoites of Nilkira species. For viral meningitis, PCR or real-time PCR is used to detect viral DNA or RNA. Another useful investigation is antigen detection. Latex agglutination test detects capsular antigens of Streptococcus pneumonia, Neisseria meningitis, Haemophilus influenza, Streptococcus agalactiae, and Cryptococcus neoformans. Culture remains the gold standard. For bacterial culture, commonly used media include blood agar, chocolate agar, and brain heart infusion broth. For fungal meningitis, CSF can be cultured on Sabarois dextrose agar or BHI agar. For viral culture, appropriate cell lines are used. Also remember that blood culture is often positive in meningitis and can help identify the pathogen. Molecular techniques have significantly improved diagnosis. In tubercular meningitis, PCR targeting the IS6110 gene and gene expert are commonly used. In pyogenic meningitis, multiplex PCR is used. Now let's move to treatment. For suspected pyogenic meningitis, empirical therapy includes IV ceftriaxone or cefotaxime along with IV vancomycin. If Listeria is suspected, IV ampicillin should be added. For neonates, it is IV ampicillin along with IV gentamicin. Adjuvant therapy includes IV dexamethasone. Definitive therapy is later modified according to culture and sensitivity reports. For tubercular meningitis, anti-tubercular therapy is followed according to national TB guidelines. For cryptococcal meningitis, the induction phase consists of amphotericin B for 2 to 4 weeks. This is followed by maintenance therapy with fluconazole for 6 to 12 months. For viral meningitis, IV clover is used, especially when herpes simplex virus is suspected. This is the pro table which summarizes all the treatments for all the types of meningitis. You can take a screenshot if you want. And that's it for today, guys. If you found this video helpful, don't forget to like, share, and subscribe to Studio Students. Thank you for watching, and I'll see you in the next video.